So the gold standard for graft material is autogenous cancellous or cortical bone from iliac crest, but the problem is that there is a limited supply of autograft, donor site morbidity, less than perfect healing success. So spectrum of bone graft options, you can see you have bone graft extenders, which are osteoconductive matrices, demineralized matrix, bone graft enhancers, where you can use osteopromotive materials, and bone graft substitute, which can be osteoinductive and osteogenic. So properties of graft materials. Osteogenesis is a cellular element which helps in synthesizing new bone at the recipient site. So you use BMP2 there. Then osteoconductive are alpha and beta TCP, HA, which does passive scaffolding, supports new bone formation and growth. And then you have osteoinductive, where you have BMP facilitating recruitment and differentiation of stem cells and induces new bone formation. So osteoconductive, you can see the group of products which can be calcium phosphate, collagen, and calcium sulfate ceramics and concentrated blood platelets-rich plasma. And in osteoconductive, you will have the DBM and the BMP. So growth factor in spinal fusion surgery, osteopromotive and osteoinductive. So osteopromotive encourages cellular division, involves in part of the bone formation cascade, but it is unable to induce bone formation alone, are not capable of mediating the process of bone formation. So you can see the platelet plasma being used here. How does we make the DBM is you use the bone consists of mineral and bone matrix. You demineralize using 0.5 m HCl. And DBM has absolute amount of osteoconductive factor in DBM is extremely low, the BMP, and the BMP can be inactive. So you have to know how the DBM has been processed to know that it is going to be effective. Demineralized bone particles and fibers, you can grind and then make the particles to make the DBM putty, or nowadays you mill and use the cortical fibers. This is a trend what used to be there before. We used to do posterior lateral fusion. Nowadays, people do interbody fusion and percutaneous screws, so this has not much to say. Osteoinductive and bone graft replacement. Osteoinductivity is the key property for graft replacement. Bone morphological proteins are the only known differentiating factors that are osteoinductive. And you can see there an experiment which shows implanting BMP on skin, and they have bone formation there. This is the content of osteoinductive particles, BMP. Blood-derived gels have 0 mg, allograft DBM has very low, and RHBMP has the highest amount of BMP concentration. Origin of RHBMP is shown here. Human BMP2 was isolated. The gene was inserted into a chromosome of a mammalian cell, and the cell line produced a pure natural human protein that was isolated and given. And mesenchymal stem cells are differentiated into forming chondroblast, and then they form the osteoblast, and then they show the form. So RHBMP 2 facts is mechanism of action has been identified at cellular level, and you can see how the two bone formation pathways do the bone formation there. And osteoinduction requires surgical implantation, and they use a collagen sponge which keeps the BMP inside and releases it slowly. NovoGrow is a totally synthetic, highly advanced bone graft substitute. It's osteopromotive. The only purpose of bone graft is to remodel and replace by bone. What happens is if you put alpha tricalcium phosphate or HA, bone forms on the surface, but the inside remains as the graft substitute. So it doesn't really fuse, it only superficially fuses. And sometimes when the movement is very hard, it breaks, and you won't be able to identify and know that there is a non-fusion. So in NovoGrow, they use the product called monotide and the calcium phosphate DCPA, which is anhydrous calcium phosphate. And about ceramic material, I just talked about it, so I don't want to waste time talking about so much in that. But the DCPA is microporous and macroporous, and it facilitates ingrowth of bone and accelerates the overall process of replacing the cement by bone. Here you can see how DCPA has more bone-like property compared to TCP, and the matrix is porous and it degrades by additive. So what is NovoGrow? Dicalcium phosphate, magnesium phosphate trihydrate, nanocrystalline silica, and polysaccharide, no animal or human tissue inside it. What does magnesium do? It increases proliferation of bone marrow stromal cells, stimulates protein enhancement for bone regeneration, and initiates appetite layer formation on the scaffold, which is very important for the bone formation. So nanocrystalline silica also stimulates collagen synthesis and growth of osteoblasts, shortens healing time by 30%. And CMC also does the similar properties of viscosity, deforming, chelting, and anti-fouling ability. So from a point of view is that the calcium phosphate is absorbed very quickly. TCP and HA take a long time, and this is a new category where NovoGrow absorbs about in 12 months. And this is a comparison.
Sorry, sir, if you can conclude fast.
Yeah, I'll conclude in 2 seconds. NovoGrow putty compared to ActiFuse, you can see there. And the mechanism is that it releases silicon and sodium ions and recruits osteoblasts. And you can see the bioactivity here. And if you see the new bone formation, it is quite good volume. And residual graft volume, you can see it decreases very quickly compared to ActiFuse. Thank you very much.